Well, while sitting at home watching movies might have seemed nice once upon a time, our day-to-day lives have been turned upside down since the coronavirus outbreak. Trips to the grocery store, going out with friends, and even working out at a gym are all not what they used to be. When it comes to health appointments, it can be extra nerve-wracking going into a doctor's office, but it's still important to stay on top of your health despite COVID-19. Joining us now is Dr. Anita Gupta, anesthesiologist and adjunct assistant professor at Johns Hopkins University School of Medicine. Dr. Gupta, great to have you with me here today. I think we're going to get a lot of good advice from you. I'm trying to consider what appointments I should start to go back to now. So what appointments should you be keeping despite the pandemic?
So this is such an important topic right now. As you know, many people want to go see the doctor. And, as a physician, one of the most important things to remember is that you want to do this on a case-by-case basis. I mean, you don't want to just make a decision without consulting a physician. And there's only a few in-person appointments that are really critically important. One, if you just had a baby, postpartum visits. If you were just hospitalized, if you had an acute condition and you require a follow-up, and if you had an acute injury, for example, trauma or any specific type of problem that requires follow-up as well. Now, there are obviously other in-office visits that people are asking questions about, and that's what we're going to talk about today, that require a case-by-case evaluation, and generally are recommended to be screened prior to making that appointment for COVID.
Dr. Gupta, one of my biggest questions is around going to the dentist, because it's been a while since I've been back, but it feels risky. Obviously can't wear a mask when your mouth is open. Someone's fingers are inside your mouth. So what are some precautions you should take either before the visit or also while you're in the dentist's office?
This is such an important question, and I've gotten so many questions about dental visits. But the most important point here is the preventative visit. And unless you're having an acute problem or an emergency, talk to your dentist, see if it's required, and first figure out if it's something that can wait. And if it can't wait, you can go in, take in the appropriate precautions. You want to always remember to social distance, wear your mask as regulated by the state, and obviously use all the preventative measures that your doctor and dentist are requiring for their specific office. Now, many states and offices are requiring very different rules, and so you want to check with them before you go into the doctor's appointment.
Yeah, to that point, I think one thing that worries me is I've had experience calling doctor's offices. You don't always reach an actual human being, and that's the kind of thing I think you want to actually talk to someone about. So what is your advice on how to really understand what is going on in that doctor's office to make sure that you feel confident before you walk in?
So look, even for my own doctor's appointments, I have difficulty getting in touch, and the important thing is to stay informed and be in touch as early as possible before the appointment. Get the information you need at your fingertips. And a lot of times the doctors will either email you the information or they'll try to call you before the appointment. Those contact points are critically important because they're sharing you information on how to prevent any exposure and minimize your risk during those visits. And also what's important to remember is that a lot of times they are offering telehealth or telemedicine visits that can triage and can evaluate you and what your ongoing problem is, and sometimes answer some simple questions that may actually minimize your need for the appointment at all. So very important to be connected, talk to your doctor in advance if you can, and certainly stay connected through email, telehealth, and telemedicine technology.
We've been talking about telemedicine a lot, but I wonder, at least in my experience, I turn to telemedicine when I'm being reactive about something that I feel is wrong. For something like a physical, where you get it annually, you don't necessarily think that something's proactively wrong with you. Is that a kind of situation also where you can talk to a doctor via a telemedicine app?
Look, many doctors are still seeing patients through telemedicine. There's no doubt that it's been a boon during the COVID-19 pandemic, but there is no one-size-fits-all here for an appointment. And many patients are really just finding that video conferencing with their doctor very helpful just to answer any new symptoms or go over their medical history or their medication questions, and really just get some basic information about their condition. And that's what's so important. I mean, you want to have that ongoing conversation and have that shared decision making, but it is only really great for chronic conditions. Now, if you're having an acute problem, that's when you have to start thinking about, having the urgent visit, the emergency room visit. And if you have a high risk condition such as hypertension, diabetes, or cancer, those concerns are even more critical for those patients.
I'm certainly taking my temperature more frequently than I ever have in my life. What are some things we can do ourselves to track our own health so that we don't actually need to go see a doctor right now?
Right. And look, lifestyle recommendations at this time are so important. I mean, you want to, number one, take care of your health, minimize, number two, take care of your stress. This is a very stressful time for so many people, and making sure that they control their stress levels, finding things that they enjoy at home, and number three, connect with people. Finding ways to find support through friends, family, and colleagues is so critically important to ensure that during this time while they're at home, that they have that support system in place.
Dr. Gupta, great advice as expected. That's Dr. Anita Gupta, anesthesiologist and adjunct professor, assistant professor at Johns Hopkins University School of Medicine.